All right, so I want to tell you a little story about my friend and my father. Not my father, his father. So yeah, my friend's father bought him this Xbox when he was 7 years old. And so they played with it all the time. They had a lot of fun with this for 2 years until he was 9. Unfortunately, at 9 years old, his father passed away. Fast forward 10 years from then, and probably he didn't want to play Xbox after this, but he decided for nostalgia reasons, let's plug it in one last time. This was the game that was in the console, and it's called Rally Sport Challenge. And it has this mechanic in time racing where the fastest lap gets recorded, and you have that ghost to beat. And maybe you can see where this story is going, but that ghost ended up being his father's fastest lap from 10 years ago. So he was racing with this ghost, trying to beat it. He was learning based on his father's expert knowledge where to turn, where to drift, where to drag, where to brake, to make the right turns to get the fastest time. And in the end, he ended up surpassing his father, but just stopped short of the finish line because he would have overridden the ghost. And so I'm not really talking about an Xbox game here. I'm talking about loss. The loss of people, the loss of subject matter expert knowledge, and just more broadly, the inaccessibility of this subject matter expert knowledge. So when you look at this group of people, what are the types of words that come to your mind? For me, it's these types of words. Crucial, experience, skillful, practice. But the reality is that we lose these people too. We lose them for many different reasons. They could move, they could find new jobs, they could retire, they could leave. The reality is they could also lose their life as well. So we wanted to kind of validate this need. We did some research, and these are kind of the headlines of the research that we did. Looming shortages, disastrous retention crisis, stunning levels of burnout. Of course, with COVID-19, there's certainly a lot of burnout. People likely to retire early. They want to leave the profession, maybe leaving their job, specific to the radiographer. That's the quote we got from them. And so a couple other validations of this need is that there's a need for improving the residency training in the context of repetition and accessibility. From Dr. Hines, it was that medical students come to the operating room unprepared for this unfamiliar environment, and the actual clinical situation and its high-performance nature is often overwhelming. So we're trying to replace this shortage crisis, and we're really looking at the training aspect of things. Also, Dr. Chen says there's an opportunity, there's an opportunity to practice their skills in lifelike situations. So I'm going to take a quick step back and say, similar to the other groups discussed here, we started off with many needs. We each brought about 10 to the table, and then based on personal interests, past experience, we discussed them, understood them more, individually scored them, and then over a threshold value, we moved to the second stage of the 6 needs. We considered these a bit more seriously, looked at the major players that are already meeting those needs, checked out their business models, and then in the end, we chose one because mostly it's something that we think we can provide a solution to practically next semester, along with the industry trends opportunity and asking our context questions. And so we come up with this sort of broad, neat, and accessible way to deliver nuanced expert knowledge to learners so that their skills increase faster and resulting hospital processes become more efficient. And I'll leave it to Jeremy now to talk about the scoping.
Yeah, thank you, Ken. So the first, as we can see, our needs is very broad and general, so we don't want that. So we start scoping an accessible way to deliver nuanced expert knowledge. So we're doing this in 3 ways. So the first is how to get more people to have access to the operation of high cost and complex equipment. And the second one is we want those people to know the already experienced the radiologists, so how they are using their diagnostic techniques. And the third, we want the radiology also involves interventional surgical technique. We also want them to know what's the nuanced surgical techniques. Then we keep scoping up. So we think the learners, scoping up the populations, we think there should be medical students and medical residents. So they already have some background knowledge on medicine and also on anatomy, so it's easier for them to learn from our program. So keep going. So then we keep scoping, and so what's the result of the hospital process become more efficient? So first is the hospital process, there should be less errors, as like the group 4 has mentioned. We want to decrease the number of errors the the radiologists make, which a study has shown there roughly be 4% of radiology errors made by radiologists like every year. That's 4%, which is the number. So keep going. Then here comes the problem. So what's the problem in our needs? So the current radiologist training takes 13 to 15 years, and the cost is a lot. And also another problem is radiologists, as a student, you don't have access to the real life situation. And even if you do, you have the simulations provided by the hospital, but they're also very expensive. And throughout your learning process, you only have like a few opportunities to do those. So keep going. So that's the situation.
Yeah, circling back to the learners. So when we were identifying the stakeholders, medical residents or postgraduate medical trainees were clearly one of the stakeholders, but also the institutions at which they learn, the task trainers, the facilities. And so to give context, the number of residents that we found in postgraduate programs here in Canada is 14,000, while in the US it's 145,000. It's important to note though that while we do, like the use cases and the solution that we're presenting and the use cases which our solution would apply to would be students, we would want to do our dealings with the institutions themselves. But the institutions, you can go to the next. The institutions, as well as the government, have a large say in the supply and demand of physicians moving forward. So for now, we know that Canada. For now, we know that Canada is currently matching the growth population in terms of the supply of physicians. But for example, in the US, it's projected that in the next 10 to 15 years, across all specialties, there will be a shortage of 15,000 to 30,000 surgeons. Globally, there are around 3,000. Globally, there are 3,000 operational medical schools. When you narrow it down to North America, it's 161, and then when you narrow it down to Canada, it is the number comes to 17. A study conducted by a widely recognized consulting firm found that for $1 spent by medical faculties in Canada and associated teaching hospitals, $1.50 was directly and indirectly generated for a total economic impact of $2.50. That equated to around $30 billion generated in this sector. So while I do want to acknowledge that our solution is not a disease, it's rather revisiting and improving pedagogical processes that will have future implications and applications that can help us better diagnose diseases and also understand the pathology of diseases. So you may be asking now, what are current solutions? Look no further. We had the chance to interact with Dr. Wonderful on Zoom. That was one example of one of the simulations, but there are 3 that we found when we looked at different institutions and literature. So you have full scale, where a trainee is completely immersed, hybrid, where in certain situations you may have an actor that may be at risk, so they can't participate, or you may have certain technologies that are used. And then you have in situ, which means on site, whereby the trainee is in a clinical environment and the participants are actually clinicians. And so the outcomes of simulations are teams are able to review and reinforce technical skills in a clinical setting. So they're able to hone in on their clinical competencies and their expertise, while providing opportunities to identify hazards and deficiencies in clinical settings, in team communication, their ability to communicate with other individuals, all in a safe and relatively risk-free environment. However, the problems that simulation centers face now is that it varies depending on institutions. It's pretty much financials that completely determine whether or not an institution is able to have certain simulation centers. And so that also affects the number of personnel that are available, and then downstream that affects the availability or the ability for trainees to repeat certain procedures and the duration as well of their simulations.
So I noticed that Natalie gave us the finger, so I'll try to be quick. So in terms of I'm just joking. I'm just joking. So yeah, by adequately addressing the problem and improving upon the outcomes that already exist, we want to immortalize the expert's knowledge by having a spatially recorded, accessible, and immersively experienced, leading to skills learned at a faster rate and a higher retention. And all of this will go towards making less errors and in the end have saved costs for the hospitals and better patient outcomes. So I think that's it. Oh, we have some supporting documentation, but I think we're out of time. So thanks very much.
Excellent, thank you. So for questions. No questions.
Can you guys clarify your need statement again? I think I just missed it.
Yeah, sure. So it's providing an accessible way for nuanced expert knowledge to medical residents to increase hospital processes. So it is a bit vague, but we've given some examples of how we might scope them up in the future. Go ahead.
I'm curious about how this simulation presumably is going to be more cost effective than what's already there.
Sure. So it goes to Zachary Hines' quote. Maybe you might bring that one. So right now, the high fidelity simulations are very cost intensive, and lately there's been new devices. It's getting into the solution side of things, but there's the Oculus Quest 2. It's more of a consumer grade VR set, about $400 Canadian, and the buzzword is metaverse, but the AR and the VR applications you can make. There are no code or low programming options, so you don't need a lot of computer knowledge in order to create the scenarios. So that would be a third party that we would use, but we would be putting in our assets and then developing the scenarios. And so the cost to the end user, would be the $400 for the VR set and whatever the subscription rate to our training package is.
And if I can add as well, one of the examples I gave for like the different simulation solutions is a hybrid simulation, and oftentimes this is like described in literature. Hybrid simulations exist because they're cost effective. Having a full-scale immersive experience is extremely expensive because you need actors and you need some what are they called? Task trainers. You need many people to be able to run that, and so we provide that option without that need of personnel, so saving a lot of money.
We also have an idea of what's it's going to be for next semester, so we may want to keep investigating on this.
So, can I ask you, I'm not going to ask you about efficiency, I've asked everyone that question, but you say you're going to transfer expert knowledge faster, I think you said that, right?
Yeah.
Faster than what?
Faster than the current need and the logistic nature. Right now you have to have the expert with you maybe, but if we can record their movements, nuanced movements that are not good enough with the video, then the learner can revisit and practice multiple times, watching them spatially from different angles to see how they address some surgery or operating high-cost equipment, etc.
So do you mean, so this isn't like basic skills, it's like expert level, right?
The creation of the simulation would be basic skills, but the person we would need to scan or to record spatially, that person would be the expert. So we'd be looking to partner with those people to asking their permission to scan.
Is shorter training.
I'm sorry?
No, it's not shorter training. I mean, it's just the fact that like you can have access to this both on-site and off-site. If you're able to repeat these technical trainings, I mean, the whole goal is that you have as much repetition as possible, so your margin of error is much smaller. So it's not shortening the time of the training, but it's giving like a wider accessibility. So you have more times to train, it's duration repetition. So you have longer amount of time that you can give to the training, and also just more times to train.
Can you just put your need statement back up?
Yeah, sure. Yeah, I think it speaks to the skills increase faster, right?
Yeah, that's what I mean.
Yeah, right. So instead of having to visit or do the day in, day out, they would be able to practice this at home multiple times. So it might be the same amount of time that they're practicing the skills, but the retention is greater with these technologies, and they would be able to do it one after the other with the repetition. Am I answering your question a bit? Or maybe not.
I think you're, I don't know what other people think, but I don't think you've captured it.
Okay,
Just
yeah,
100%.
maybe
I
we'll
know what you
revisit.
mean, but they're kind of different, right? Ease of use, ease of repetition. It's not the same as learn it faster, but I get where you're going.
Okay, sounds good. Yeah, we might refine this. Of course, we'll be pivoting and finding our niche as we go.
That's a good question.
I guess it's, yeah, a little more of a comment that I think based on the discussion, you kind of have two ideas. So one is like actually doing a simulation of your training, and the other is a recording where you can basically study the recording over and over again, right? This is kind of the two ideas that I'm hearing coming out. So like a VR experience where you're in there, and one, kind of what you were saying, is more like you can watch the surgeon that you've recorded do the surgery over and over again, right?
Yeah, within the simulation.
Within the
Yeah, within the simulation versus actually you doing a simulation practice.
Yes,
Is what
but-
kind of what I was understanding from what you were saying.
Okay, I'm sorry. Yeah, if it wasn't clear, but
Okay.
in that space, in that simulation, you could even like match the ghost with your movements, so
Okay,
that you would be
okay.
seeing what they're doing, and you would be learning those nuanced techniques rather than like two separate scenarios.
Okay, okay.
Does that make sense?
Yeah.
Thank you very much.